Hello everyone, and welcome back to another episode. I'm Dr. Judy, and in today's video, I have an amazing guest, a sleep medicine physician, Dr. Funke 𝗪𝗲𝗏𝗪, and she's going to share with us all about how you can get better sleep, how your kids can get better sleep, and today's episode is going to be so good, so make sure that you have a notepad with you so that you can take notes, and be sure to like and subscribe and put your comments below with regard to this video. So thank you so much for joining me today, Dr. Funke. I'm so excited to have you here.
Thank you for having me, Dr. Judy. It's a true treat. Thank you.
Yes, I've been following you for a while, and I know that you are doing some big things. And I know that you're a pediatrician, you have a sleep medicine and pulmonary fellowship that you obtained, and you have your own practice where you see kids and you see adults and you help them to basically sleep better. So you see people with insomnia, with obstructive sleep apnea, and then also parents that have children that have what you call bedtime resistance. I was like, ooh, I love that term, meaning they don't like to go to bed, they don't want to go to bed. So let's get started, because this is going to be so helpful for the moms that are listening. And we'll talk about insomnia. So can you give us some tips for moms who have kids that are having trouble sleeping? And whatever the gamut of that covers, whether they don't want to sleep in their own bed or they don't want to go to sleep at all, they have a temper tantrum and it's bedtime. Like, this is so stressful for parents. I know, I see my friends and everything talk about it. So what are some tips for moms that are dealing with that with their kids?
Yeah, that's a great place to start. So I think foundation is so important. So for me, even before we tackle like specific issues, one of the things I start off with is let's build a healthy sleep foundation. So what does that look like? I use this acronym, which is CREATE, CREATE, create healthy sleep habits, right? Because when we build that foundation, honestly, I would say maybe 50% or sometimes even close to 75% of the sleep issues are addressed if you can follow this. So, and these strategies are not just for the kids, but also for the moms, for the dads, for anybody that's having sleep issues or anybody that's looking to optimize, up level their sleep game, so to speak. Right. So CREATE, C stands for consistency. This is so important, and it's scientifically proven that when you have a consistent bedtime and a wake up time, it helps with synchronizing what we call your circadian rhythm or your internal clock. And when that is very regular, it actually helps you to fall asleep better. It actually helps you to perform better during the day. So doing the same for your child, doing the same for you as a parent, or even if you're not a parent, I think is just so important. I have a lot of kids who have just really erratic bedtime. They wake up anytime. All of that can impact their sleep and contribute to the sleep struggles that they're having. R is the routine. So many of us know, you're reading that book to that child, you're singing, you're cuddling. And then as they get older, we just throw those routines out the window. Routines are a way to cue your brain to say it's time for bed. You got to wind down. I'm sharing this not just for the kids, but also for the adults, right? You also want to have that ability to sort of de-escalate after running, busy, going through your day, to be able to wind down. And so that routine will just be 2-3 activities, pleasurable activities that can get you to bed. And then A stands for assign the bed for sleep. So many times the bed is used for all kinds of things but sleep. Yeah. We're playing video games, TV, we're eating, we're arguing, we're worrying, right? Yeah. And so we're doing homework as kids get older. And so your brain doesn't even know what you're supposed to be doing in bed. Okay, so you want to do only sleep-related activities in bed as much as possible. I must have missed an E before the A. Is your bedroom environment. So this is so important. So your bedroom should be cool, it should be dark, and it should be noise-free, because all those things will interrupt your sleep, interrupt your child's sleep as well. And then A is assign the bed for sleep. Then T, I talk about tackling technology. And, that's a whole episode on itself, right? We all know how much technology
on the
phone. Exactly. On the phone or on the laptop, finishing those emails or those notes, right? Now, one thing you have to know about kids specifically is their cornea is very transparent. So the light from the phones, we all know, we've all heard about like your brain melatonin and sleep and the sleep hormone, right? So for kids, that light impacts them even more than adults because their cornea is so transparent. So this is where you really need to be very strategic about exposing them to electronic devices before bed. Usually I would say about 30 to 60 minutes before bed, you really want to stay away from electronic devices and things like that. And then E usually will stand for eliminate. So what are you eliminating? Maybe heavy meals, maybe spicy meals, caffeine, alcohol, all those things that you know that when you put into your body, it's more likely going to make it hard for you to sleep. You might start to develop reflux because you had a large bowl of pasta just before bed, and you're like, why am I tossing and turning? Well, because your body is not meant to be working on
Right.
digesting food. Your body is meant to be resting right during sleep. And then, something like caffeine stays in your system for hours, 6 to 8 hours is the half life, meaning that 50% of that caffeine is gone in about 6 to 8 hours. So based on your metabolism, and some kids also, I've seen 2-year-olds with a sippy cup full of soda, right? So I'm just gonna put it out there. Iced tea, caffeinated beverages, really kids don't need to be drinking all of
Yeah.
that. So I think that foundation is so important. You can take one or five and say, okay, am I really being, very diligent in making sure that I'm following through with this? And then if you are, and now you're still having kids that are now struggling with one kind of sleep issue or the other, then we can delve into like, where is the problem occurring? Is it at bedtime? Is it during the night? Is it early morning? And then we can figure out how to go from there.
I love that. I love mnemonics. Create. So you mentioned E, the environment. One of the E's was
Mm,
environment as far as turning down the temperature. I noticed that that
mm,
helps to sleep
mm,
better, turning down the temperature in the room
mm,
by several degrees compared to what
mm.
you have it during the day makes a difference too.
Yeah, absolutely, absolutely. And I mean, there's a wide range. Some people will say 65 to 72. I think it's really listening to your body.
Okay.
We don't want you frigid where your teeth are shattering because then you're not going to sleep.
Right.
But we don't want you feeling like you're sleeping in a sauna either. And the reason why is because your core body temperature drops during sleep. So that facilitates or helps your brain to start to produce melatonin, which will then help you sleep better when it's cooler.
Gotcha. And you mentioned consistency. So for children, is there like an ideal body time that kids should go to sleep? Because, for adults, I think they say like 10 p.m. or like before 11 or something. Can you give guidelines for adults? Is there
Yeah.
like an ideal time to go to sleep? And then is there an ideal time for children?
Yeah, that's a great question. So there's really not an ideal. It's all about, again, it's so individualized. And I usually say sleep is like a pair of shoes, right? Like I wear a size 9, but if I try to wear a pair of size 11, I'm gonna trip. If I try to wear a pair of size 7, it's gonna hurt. So it really is fine what works best for you. And there's no really ideal time. I think it's the thing about it is our bodies, we all have what we call specific sleep chronotypes. What is a chronotype? A chronotype is just like almost like your sleep imprinting, your sleep time imprinting. So for some people, they're night owls. And so trying to get a night owl to go to sleep at 10, it's unfair. It's going to create insomnia because they're going to be in bed, are wide awake and stressing out about why they're not sleeping and trying very hard to sleep, which is really what insomnia is
Right.
about. So if you're a night owl, then your ideal time is, might be later, right? But you also have to consider what the society is catering towards. The society is catering towards morning larks. So you can either be a night owl or a morning lark. So those people, those annoying people that come singing at you at 5:30 a.m. that you just want to shut them up.
Yeah. So not me. I'm like, it's too early
I
for
know, but there
this.
are just some people ready to take on the world. I happen to be
Yeah.
one of them. But imagine me trying to wait till 11 p.m. to go to bed. I would be exhausted. Why? Because by 5 a.m., my body naturally wakes up. So even if I try to,
Mm-hmm.
or probably usually I wake up about 5:30 or so, but usually I need to be in bed by about 9:30 or so, or about 10 latest, because I'm not a night owl, right? So I think that really determines the timing. So that timing piece is just one aspect of sleep. And usually I talk about restful sleep being made
Mm-hmm.
up of three components. Okay. The timing was what we just talked about, and which is important. You want to try to go to sleep as well aligned with your circadian rhythm as possible. There's also the quantity of sleep, right? So adults sleep 7 to 9 hours, kids sleep, school age kids will sleep like 9 to 11 hours, babies will sleep anywhere from 12 to 16 hours. So that also varies based on age. And it's a range, 12 to 16 hours. Some kids will sleep 12 hours, some kids need 16, right? And so that's another component of restful sleep. And then the third thing is the sleep quality. Like I always say, I don't care if you're sleeping 8 hours or 9 hours. If it's 9 hours of crappy sleep, I don't want that for you. I want you
It's
to
not
have
good.
restful, refreshing, restorative sleep. And that really speaks about the quality of sleep. And so what can disrupt sleep quality would be different things, right? Anywhere from caffeine, alcohol, environment to a sleep disorder like sleep apnea or restless leg syndrome or things like that. So that can affect your sleep quality as well.
And I love that your username, your website and Instagram is Restful Sleep MD, which is so good because sometimes you could be in the bed and you're like, okay, I've got to get my 8, 9 hours sleep, but you waking up in the middle of the night to use the
Yeah.
bathroom or something like that, or it may take you a long time to get to sleep.
Yep, absolutely. And so that is no perfect number, no perfect timing. It's really like you listening to your body. Like, how do you want to feel? And that's how I do when I work with clients. Is how do you want to feel when you wake up in the morning? Not just like I'm ticking off my sleep tracker said I got 8 hours of sleep. Like, what does your body tell you you're getting?
Oh, I like that. So pay
Yeah.
attention to how your body feels. Like, do you feel tired at this
Yeah.
particular time? And then what time do you normally wake up in the morning? That's good because I always feel bad. I feel like they make you feel like you're supposed to be a morning person. Like it's like you're supposed to go to bed by 10 p.m. and you need to wake up by 5 a.m. And if you don't, like you're failing.
Yeah, no, it's so unfair. And it's set people up for years and years of just so much stress because they do feel like their sleep is broken. And sometimes their sleep is not broken. It's just that their perception and their understanding of their bodies need to change.
Gotcha. Gotcha. That's so good. That's so good. So you mentioned about insomnia, and can you talk about obstructive sleep apnea and define what it is and what are some signs that someone might have it?
Yeah, yeah. So obstructive sleep apnea is when you have pauses in your breathing during sleep. And if you think about it, you're sitting upright, you're breathing in and out. When you go to sleep, your muscles, especially around your neck, your airway, the muscles relax. You're laying down, right? And so what happens is you have interruption in your breathing because of all these floppy tissues at the back of your throat. Sometimes your tongue might also fall back. Sometimes you might have big tonsils, especially in children. And so what does that result in? It results in interruption in your breathing. If you're not able to breathe, you're not getting oxygen in. If you're not getting oxygen, your body goes into fight flight response, which it says, let's get you out of any type of stage of sleep you're in to a lighter stage of sleep. And so now when you're having that multiple times throughout the night, that is what we call obstructive sleep apnea. The way we usually have people present is commonly snoring, right? Snoring, restless sleep, sometimes teeth grinding, sometimes mouth breathing, gasping, pauses in their breathing, and things like that. And the way it's diagnosed, and then daytime issues. So for kids specifically, you might have kids who are very hyperactive, very inattentive, very impulsive. For many adults, they might have excessive sleepiness. They're not enough during, lunch. They're not enough when they're driving. They're feeling sleepy all the time. The way it's diagnosed is through what you call a sleep study. And so it's you use multiple channels to measure and observe the patient sleeping. And then based on that, we can determine if there's sleep apnea or not, based on the severity of the number of breathing interruptions or apneas the patient has.
Okay, so that's so good. And I know we had talked briefly before that children can have obstructive sleep apnea.
Yeah, yeah. So the most common, probably about, I think depending on what literature you're looking at, about 6%. The prevalence is about 6%. It's not as high as in adults, but I would say I think it's underdiagnosed because people don't recognize it, right? And as a school age child, for instance, might have sleep apnea, but he's not sleeping in the same room with his parents. So they might not know, but they may just notice, oh, this child is very, inattentive, very impulsive, seems to be tired. And guess what? He gets diagnosed with ADHD. Meanwhile, the issue might be
Wow.
sleep because the manifestations of a sleep disorder, including sleep apnea and other sleep disorders, is ADHD-like symptoms. And so there's such a tight overlap that this is something that I usually, when I work with my patients, when I do go around to speak, is before you have your child getting all this testing, which the child might have ADHD. So I agree that it should be evaluated. But please make sure sleep is optimized. Imagine a child getting a neuropsychology testing, which is the testing we usually do for ADHD. After a bad night of sleep, they're going to be impulsive, they're going to forget stuff, they'll have a hard time sitting still. And so that diagnosis is something we need to
Wow.
take in light of is it, or is this just really bad sleep? And I'm not saying one or the other. I'm just saying let's just be very aware because they often present similarly.
Wow, that's so important. I didn't know that. So children can present with hyperactivity similar to ADHD.
Absolutely.
And it seems to be more diagnosis being
Yep.
made in recent years of ADHD. So that's really, really
Yep.
important.
And guess what else has been going up? The number of sleep issues that kids have. So,
Oh, wow. Yeah, you're
so
right. And
yeah.
they sleep often in a different room as the parents, so then they won't hear them snoring. So that's a really good tip. If your kid is being hyperactive, impulsive, memory problems, it could be sleep apnea.
Yeah. Yeah.
And it could be related to tonsils. It's not necessarily related to obesity in all cases.
Not all cases. Some cases, yeah. Especially now, there's a rise in the number of children that have obesity. So that might be the cause because now you have a lot of fat either on their chest or around their neck, on their tongue. So all of that makes the airway narrower and can cause them to have apnea. The tonsils tend to be bigger in young kids, and so that's usually a very common culprit as well.
Okay, got it. And so if someone suspects that their child might have insomnia or obstructive sleep apnea, would the first step be to see their pediatrician and then the pediatrician would refer them to a sleep medicine doctor like yourself?
Absolutely. And I would say many times, I love pediatricians. I'm a pediatrician too. Many pediatricians are busy. And sometimes moms don't know, or parents don't know how to explain the symptoms. So you have to make sure you get an answer. Because if your gut is telling you something is wrong with your child's sleep, then most likely something is wrong with your child's sleep. So don't just wait for them don't let them just say, oh, don't worry, they'll outgrow it. Ask
Yeah.
to be evaluated, ask for testing. Because, I've had kids on 3 or 4 medications for daytime behavioral issue, mood, ADHD. And after working with them and resolving their sleep issue, they were able to come off medication. So
Wow, that's
again,
major.
it's an easy fix to just pop a pill. I'm not against that, but let's try to figure out what the root cause. Where is this coming from? And there's help out there.
Yeah, I love that. Because medications do have side effects. They're expensive. You have to pay for them. So that's a really good tip for moms, for parents out there.
Yeah,
Now we're
absolutely.
talking about hyperactivity in kids. So I know that diet is related to that. You mentioned caffeine, sugar. Have you noticed any correlation between the diet of children and their sleep, such as eating junk food later in the day or eating too much junk food, like period?
Yeah, both ways. So diet plays a big role. If you have a lot of processed foods in your system, if you have a lot of, things that are contain stimulants. So with caffeine, it's not just soda or iced tea. Sometimes it might be chocolate.
Yeah,
Right?
chocolate.
And for
Yeah.
some children, they're just more susceptible to the effect of
Yeah.
those substances than others. Sometimes it's the sugar, right? They had a dessert that now is driving them up the wall and it's making it hard for them to wind down and sleep. So we see that. The other thing we see, I mean, I see it more in teenagers and adults, is this phenomenon where when you have consistently poor sleep, you tend to have cravings for sugary things and salty foods, right? If you think about it, if you even as an
Yeah.
adult, right, you're like, oh, I had crappy sleep. You crave sugar. You're not going into the fridge and grabbing a carrot, I always say.
Right.
You're probably grabbing a carrot cake, right?
Exactly. Like, let me have some chocolate or ice
Yeah,
cream.
just something, right? So there's some hormonal changes that happen when you have poor sleep. There's the leptin, which is supposed to be that hormone that tells you you're full. But when you don't sleep well, it's low. And so it makes it feel like you're not full. And then there's the ghrelin, which is the hormone that tells you you're hungry. And so, it becomes really, really high when you're not sleeping well. So there's a flip. And so because of that, you might respond. And then executive function and your ability to make good decisions is impaired. It's affected by poor sleep. So now you're not making good choices because you had crappy sleep. And then you now have these hormonal changes that are driving you to say food, more
Man.
food, more food, right? So it's not a good setup. And so because of that, we see the obesity and all the other consequences from that.
Yeah, when I work with clients with my group coaching programs, my health programs that I have, I always address sleep first. As a lot of people are dealing with weight loss and they're struggling losing weight and don't realize the connection between sleep and how important sleep is. They may be working too long hours, night shifts is
Yeah.
notorious for interfering with your circadian rhythms and your hormonal levels, like you mentioned. And I'm like, okay, how are you sleeping? Do you feel restful in the morning? How much hours are you getting sleep? And I used to work night shift years ago, and I noticed every time when I work night shift, I would crave junk food on the shift. Like I just want to eat chips, chocolate. It was just so weird. And I had to leave night shift just for my health because I noticed
Wow.
that I was just eating more junk food. So I switched to doing like day shifts, hospitalist. That's what I used to work as until a year ago. I left clinical, but I used to work in the hospital, and I was like, oh no, I can't do night shift because this lack of sleep is
Yeah.
making me eat unhealthy, and I started to
Yeah.
gain a little bit of weight. So yeah.
That's true. That is so true.
Yeah. So what are some of the biggest, I guess, challenges that you see in patients that you see right now with regards to lifestyle habits, excess weight? You know, I feel like there's a rise in obesity, and the statistics say that by, you know, like this year, there's going to be more people with obesity, and that increases type 2 diabetes and other health conditions. And then we're seeing it in children as well. What are you seeing from the pediatric side as far as the increase in excess weight or
Yeah.
blood pressure? Yeah, blood pressure
Yeah.
issues.
Yeah, it's kind of similar, maybe a little bit of a mini version of what we're seeing in adults. There's definitely a rise in obesity. There's just access to unhealthy foods. And healthy foods are, let's just be real, healthy foods, they can be more expensive than junk food, right?
Yeah.
You get a Big Mac for, I don't know, under $5. Try to get a salad. It's like triple that amount, right? So,
Right.
and
And
they
if you
make it,
substitute, if at the restaurant you want to substitute the bread for like
yeah,
lettuce, or you want to
yeah.
substitute something for like avocado, they charge you
Yeah.
extra for it.
It's an upcharge. So the system is not set up to promote even the healthy foods intake. And then the other piece is, with kids, device use is big. And so that's also contributing. So sitting, watching TV, very sedentary lives with a bag of chips, not really active, and physical activity has been shown to improve your sleep quality overall. So if you have a child who's not physically active and who's eating a lot, then they don't really sleep that well. And so they're more like, they have more cravings during the day, and you just have this
Yeah.
vicious cycle. And so I think that's another thing. And then just, technology access overall is limiting the amount of sleep kids can get. And then, with the excess weight, it becomes a risk factor for things like obstructive sleep apnea. So we just have this constant vicious cycle. And so we're seeing that. We're definitely seeing it in younger age group. We're seeing it, in teenagers. We're seeing it across the board.
Yeah. Yeah. Sometimes, I often get parents who are trying to eat healthier. They're having a difficult time, they say, with getting their kids on board with eating healthier. And I know that you have kids. Can you share, have you had any struggles like that, or what has been your experience with trying to get your kids to eat healthy food? What tips do you have for moms?
Absolutely been there in it. Literally before we got on this call, I fixed lunch. I made like chicken for my daughter, and we had chicken. I had made a chicken quesadilla, and I was asking her what color she wanted. So we tried to say, okay, what color of food? So she said, oh, maybe she'll have like, I don't know, grapes or something. So I said, okay, how about we swap the grapes for tomatoes? So, the cherry tomatoes, which are delicious. And I had a whole bowl. I leave it in the kitchen. You could have seen the face she made. So we had to bargain because she's a twin. She's 12. So it's
Right.
not like, we depending on their age, you do need to start to have conversations rather than it's hard for you to say, oh no, you absolutely have to eat this. So then we had to bargain, and
You
I'm
had to
like, okay.
bargain.
So she's like, it's very hot here in Philadelphia. And so, this evening I said, okay, you know what? If you eat 8 of this cherry tomatoes, I'll take you for water ice. She's like, okay, 5. So here we are bargaining. She's like, okay, I'll eat 5 and I get what I said, oh, you'll get only half a cup of water ice. And then I'm like, if you take 8.
I
So
love that. So you can bargain with them. Yeah, but that age just helps
it
to have some
is.
autonomy.
Yes, it is. But I think one tip I would say is, yes, make it fun.
Yeah.
Find ways to just incorporate it combine it with stuff they love. Be willing to bargain sometimes.
Yeah.
And then I would say also role model it, like make it such that
Yes.
the junk food is not easily accessible
Right.
to them, and let them see you. Like I was making this ginormous bowl of salad, and I was just talking about how excited I was to eat the salad.
Mm-hmm.
And I knew she could hear me, but I didn't make it like I was talking to her. I'm like, oh my gosh,
Right.
I'm so hungry. I'm looking forward to just delving into this salad. So be that role model, and the same for sleep, right? Like if they see you on your phone scrolling nonstop on Facebook doing the doom scroll, it's hard for you to say no, get off your device and go to bed, right? So we do need to role model because they're watching what we're saying more,
Yeah.
or watching what we're doing more than hearing whatever it is we're saying.
Yeah. That's so good. Being a role model and modeling that
Mm,
behavior that you want your child to adopt. You're right, because children will call you out. If you're trying to get them to eat healthy and you're eating French fries, they'll be like, oh, mom,
yeah,
you eating French fries? You got chocolate. I saw you eating yesterday.
exactly.
They will call you out.
Yeah, yeah, they will. They
Yeah,
will.
that's so
Mm,
good. It's also helpful too to have them be a participant in the
yes,
grocery shopping process and even
yes.
the cooking of the food process.
That is absolutely right. I think that is so, so important. Like for us, kind of lives we live, I sometimes have to shop online, like
Yeah.
grocery shopping online just for ease. And what I end up doing is, okay, what healthy options do you want? I want you to put it in the cart,
Oh,
but going to
nice.
the grocery store and having them pick out, some options and being involved in that process, I think is great.
Yeah, that's so good. It's really an active process to not
Mm.
eat unhealthy food because most of the food in the grocery store
Yeah.
and the restaurants is processed with a lot of
Mm.
sugar in it. So you have to
Mm.
really be very, very mindful and
Mm.
vigilant on what you're
Absolutely.
putting in your cart.
Yeah.
So this has been so good. You've given us so much information for parents, for women who are, having sleep trouble. So now I want to ask you about insomnia. And I see this a lot with women, men even, adults who struggle with getting sleep. Either they're waking up during the night, they're laying in the bed and their
Mm.
mind is racing. They just can't shut down their thoughts for the day. What tips and advice do you have for someone who's struggling with sleep?
Hmm. Yeah, so that's a very common one. The waker uppers. It's either 3 a.m. or 2 a.m.
Yes.
So I usually will say the first thing you need to do is not panic, because I see people get into this cycle of frustration because now you look at the time and you're like, oh my gosh,
Right.
it's 2:30, now it's 3 and I got to wake up at 5, and you're already catastrophizing about how horrible the day is going to go. So just like chill, pause, and just accept the fact that you're off and get a little bit comfortable with it, because the more you resist it, that state of
Hmm.
wakefulness, and the more you try hard to sleep, the harder it gets. So when you do that, that just kind of frees you up. And so what does sort of that being comfortable look like? Well, it could be a period of where you just practice some mindfulness. What are the things that I can see in the room? What are the things that I can hear? What can I taste? What can I feel? So once you start to kind of get yourself out of being in that cycle of thoughts to being in the moment, it really does help you to relax. Some other things that I recommend is, breathing exercises. So deep breathing, there's so many methods out there. You can find what works for you. But if you're at the point where you've tried to relax and you're finding it hard, you find like you're tossing and turning and it's been a few minutes, then at that point I recommend that you just get out of bed. Get out of bed and find a nice, quiet and comfortable area and just do some activities that are relaxing for you. So for some people it could be journaling, it could be, reading, listening to music, whatever. And then once you start to feel sleepy again, then you get back into bed. So that's my go to tip on the background of those healthy sleep habits. So don't forget that as well.
Oh, that's so good. So if they're having trouble getting to sleep, they can get up and go
Mhm.
somewhere and journal. I like that mindfulness piece because I had not thought of that one. I'm familiar with that during the day. Like you can count like it's like 5 things you can see, 4 things you can hear, 3 things you can touch, or something like that.
Mhm.
I found that having a bedtime routine is helpful, just kind of like mindfulness. I listen to
Mm.
this it's like a Christian meditation thing on this Abide app.
Oh
It's like
yeah.
15 minutes. It really helps me
Mm.
to unwind and it's like a habit now. So like when you talk about consistency and a routine, now it's like, okay, I get in my bed, play this 15-minute thing, and then it makes getting to sleep a lot easier. And it's funny because I've never had a evening routine until maybe like a year ago when I was having some sleep problems. And oh my goodness, having the sleep routine is like so helpful. Like it's just unbelievable. And sometimes I would journal too. That's been helpful too.
That's awesome. I'm so happy you picked that up. Again, imagine if you didn't, you may have ended up on medication for sleep. Meanwhile, it was this fix that you needed to incorporate, which has made a big difference.
Yeah. Yeah. Because once you know, like you talk about the environment and only sleep in the bed, not doing work and other things like that, it mentally prepares your mind to prepare to sleep. So yeah, so sleep is super important. And this has been such a good episode. We'll have the links to your Instagram and your website below. And I love that create mnemonic. We'll probably see if we can type that. That'll probably show up, I think, in the show notes. I love that create mnemonic. So I know that this was so helpful for our viewers and to everyone watching. Make sure you like, subscribe, follow, share this episode with someone, and comment below your favorite takeaway from this episode. And Dr. Funke, thank you so much for joining me on this podcast. It was such a pleasure. I learned so much, and I know that my audience did as well. And again, we'll have the links to your website and your Instagram, Restful Sleep MD, so that the people can follow you and get more tips about sleep from your platforms.
Thank you so much. Thank you so much for having me, Dr. Judy. It's been so much fun.
Thank you. Thank you so much. And for everyone watching, thanks so much for tuning in. And I will see you in the next video. Bye.